My name is Nicole Brown, and I will be discussing ADHD treatment methods. So what is ADHD? Attention Deficit Hyperactive Disorder is a behavior disorder that affects 11% of children ages 4 to 17. The CDC does report that 2/3 of children diagnosed with ADHD are on medication. Behavior therapy is now a recognized treatment method that is recommended before the use of medication. My paper and this discussion will address the benefits of behavior therapy and also why it is recommended before the use of medication. Translational research can be defined as the bridge between basic and applied research. It allows us to implement areas of study discovered in basic research within an applied setting. Prevention and treatment strategies also play a major role in translational research. It can be used to improve health and quality of life by transferring knowledge obtained during clinical research to actual communities. Delayed discounting. Delayed discounting is one of the major concepts of this presentation. Delayed discounting can be defined as the subjective discounting of value of a reward or a reinforcer. As the reward or reinforcer is moved further into the future, the reward is discounted. It loses its value. Children diagnosed with ADHD that lack impulse control discount reinforcers at a steeper level. Maladaptive behaviors can be described as problem behaviors that include disruption, destruction, and aggression. A major characteristic that affects children diagnosed with ADHD is that they lack impulse control. Research has shown that children are more likely to engage in impulsive actions due to lack of immediate access to the reinforcer. In a study conducted in 2005, the results displayed that when the reinforcement schedules are short, impulsivity decreases. In a 2000 study, 2 boys diagnosed with ADHD were assessed. The study revealed that when continuous and immediate reinforcement patterns were used, the behavior of children with ADHD was comparable to children that did not have an ADHD diagnosis. Delayed discounting shows us that children diagnosed with ADHD discount items as they move further into the future. With delayed reinforcement, this leaves room for impulsive behavior to occur. So the question is stimulant medication effective for ADHD treatment? 2.5% of children take medication for ADHD, but due to its possible misuse and actually overuse, the use of stimulants should not be the sole treatment method for children diagnosed with ADHD. In a study consisting of 58 participants, the results show that medication had little effect on controlling impulsivity. A replica study was conducted with a total of 4 participants diagnosed with ADHD, and the results also showed that regardless of if the child was receiving stimulant medication, the reinforcement selection, which included a smaller but immediate reinforcer, was chosen. And that shows you that across the 2 studies, despite the presence of medication, high levels of impulsivity were still present. Behavior therapy, on the other hand, is an empirically supported treatment method that has been shown to increase academic ability while improving behavior. Behavior therapy that includes the use of parent training has shown to be an effective treatment method when working with school-aged children. SDBT, another branch of behavior therapy known as structured dyadic behavior therapy, is also an effective approach that teaches self-regulation techniques as well as social learning strategies. SDBT allows a therapist to use model prompts that target impulsive behaviors as well as socially interfering behaviors that children diagnosed with ADHD may engage in. It allows children to rehearse and practice scripts in order to acquire social skills when faced with these everyday situations. Behavior therapy allows children to repair processes correlated with lack of impulse control, while allowing for an increased rate of reinforcement as well as immediate feedback regarding target behavior. These are strategies that are shown to decrease impulsive behavior in children that are diagnosed with ADHD. In a study reviewing 600 participants diagnosed with ADHD, results showed that behavior treatment models that included parent training, school intervention, as well as child interventions are effective methods for treating children with ADHD. So after research, I found that although children diagnosed with ADHD may take medication, it does not control impulsivity. Behavior therapy, on the other hand, takes into account that children diagnosed with ADHD may lack impulse control, and they do develop strategies and treatment techniques in order to account for that, to teach children how to exert self-control. Research has shown that the use of ABA principles in a school setting have been known to reduce stress level of teachers as well as parents when incorporating techniques such as behavior contracts, reinforcement of desired behaviors, as well as the use of token systems. In addition to this, studies have also revealed that when providing children with choice of which reinforcer will be presented, this allows for an increase in desired behavior. Reinforcement evaluations, as well as preference assessments, allow practitioners to evaluate preference of reinforcers that could potentially be presented to our clients. The field of ABA has the potential to make significant contributions to various aspects of human behaviors, in that we are trained to analyze and identify motivational operations. The field of ABA allows us to understand and classify behaviors, and it also allows us to successfully manipulate variables that enhance human conditions. Although the effectiveness of ABA as a form of behavior therapy has not been measured, key strategies practiced by behavior analysts are used in the behavior therapy treatments that were discussed. With an increased prevalence rate of ADHD, as well as behavior therapy recommended as a first line of treatment, it is important that as behavior analysts we are aware of effective treatment strategies when working with children that are diagnosed with ADHD. In regards to impulse control, research has shown us that when continuous and immediate reinforcement patterns are used, the behavior of children diagnosed with ADHD becomes similar to the behavior of children that do not carry an ADHD diagnosis. Delayed reinforcement schedules are not beneficial for children diagnosed with ADHD and may lead to an engagement in maladaptive behaviors due to lack of reinforcement or motivation. Children diagnosed with ADHD benefit from a shorter and more frequent rate of reinforcement. In order to decrease impulsive behavior, motivation can be increased by increasing the rate of reinforcement while providing quicker access to the reinforcer. Although other fields may incorporate ABA strategies, as behavior analysts, we surely have an advantage due to our extensive training in the field. Our training allows us to administer choice assessments, identify motivators, as well as identify and manipulate variables in order to enhance behavior. Although research has shown that behavior therapy is an effective treatment method for children diagnosed with ADHD, this actually includes clinical behavior interventions as well as cognitive behavior therapy, which at times is practiced by counselors and psychologists. Although ABA strategies are incorporated, there is limited behavior analytic research about the use of applied behavior analysis when working with children diagnosed with ADHD. I think that as a field, because behavior therapy strategies do incorporate ABA, it is important for us to contribute to the field by conducting behavior analytic research in order to find the most effective strategy for teaching children diagnosed with ADHD how to wait. And once we look over the research to see what the most effective strategy is, Then the next question would be, how do we apply this to the school setting? This will play a major benefit in the school system and a major benefit to children diagnosed with ADHD, because at this point, not only are we decreasing impulsivity within this population, but we are also teaching them how to wait and sending out reinforcement schedules so that their behavior can be aligned to their peers. I think that this is a very important topic to the field, because as the ADHD diagnosis is on the rise and behavior therapy is becoming more and more recommended by physicians, it is important to realize what strategies are most effective when working with this population, and also recognizing how we can help children with ADHD to the best of our abilities while using behavior analytical research methods as well as techniques.